Hi, it's Dr. Noel Williams, March 28, 2021. I'm on take 3. I'm going to stay completely away from the subject of testing because I can't say anything nice about it at this point. So let's talk about, or politically correct. So let's talk about Texas. 17 days, I believe, without any kind of mitigation strategies. And what happened to their numbers? They've all fallen. Why did they all fall? They fell because we're at herd immunity, essentially, or very close in Texas. Mitigation strategies are short-term strategies. They're never long-term doing them. Now we've gone through mitigation phases multiple times. Why did we do that? Because we failed as a medical community, not necessarily me, but on a governmental level, because you take that 3 to 4 months to get data and figure out how do we stop this disease in its process if possible. We got that data. We knew by end of March, beginning of April for sure that steroids were beneficial. We knew that Plaquenil worked. We had a sense that ivermectin could be helpful. We knew that people were having lots of blood clots and we needed to put people on blood thinners or aspirin or omega-3 outpatient. So we needed to do all this outpatient stuff to stop inpatient events. Well, we didn't do any of that. So then what happened is the weather got a little better, and that's why it really slowed down in retrospect, and that's been shown in some papers. And then it kind of came back when people relaxed a little bit on mitigation and the weather changed, and then we kind of fiddle-faddled through the summer, and then it pulsed then in the fall like we expected. So once again, mitigation was never going to be the right strategy. It doesn't really work that well, and we already knew that. And anyone who's a public health person who's actually trained in public health and preventive medicine for infectious disease knows mitigation strategies don't work. We have to have a solution when it's a cold type virus thing. It's not the same as like an STD, like HIV or something. You can mitigate that through safe sexual practices. There's no such thing as doing that with a cold or flu virus. It's going to spread. So anyway, so that's where we kind of are now. The country's hitting its stride in terms of vaccines. It's hitting its stride in terms of herd immunity. So hopefully our state, Oklahoma, and a lot of states will start easing back on the face mask restrictions and all that stuff because they really aren't needed anymore. So who should still wear a face mask? Well, if you're a high-risk patient or a moderate-risk patient and you didn't get a vaccine, then you should wear a face mask. It's that simple. If you're someone who's been vaccinated, you don't have to. If you're someone who's really low risk, you probably don't have to either. Like, I don't think kids need to wear masks. It's stupid. All the data shows it's stupid. Now, it's just kind of like, why would we vaccinate kids when they have no harm from the disease? It's stupid. Sorry. And this whole mitigation strategy or the treatment strategy to prevent COVID of vaccinating children, which is going to be the next big thing because there's just like, I don't know, 22% of our population or 60 some million of them. So that's a lot of vaccines with, well, someone else can do the math. But the bottom line is we reserve the meningococcal vaccine till what? When they're 18 before they go to college or something or get a job. So why? Because that's when meningococcal infections start to occur with frequency. We don't give it much earlier than that. So why would we give a COVID vaccine to a group of people who don't get sick from it until they're really 18, but they don't even get sick from it when they're 18, but they can start to spread it when they're 18. There's scant data showing 17 and under people die from COVID. There's scant data showing any kind of transmission. We don't know long-term what the effects of the vaccines are going to be. We think that they'll be safe, but we don't know, so why would we give them to kids? That's my opinion on it. It may go against the grain for some people, but the reason you do the vaccine is if you could get a benefit. And if you can't get a benefit from the vaccine, why would you do it? And the kids can't get a benefit because they don't get that sick. It's barely noticeable. I mean, the latest data a week and a half ago on real deaths from COVID in the United States in 17 and under was zero. I'll hold my zero. It's not this huge number of kids. It's none. So why give them, there's greater risk with the vaccine, just with vaccine reaction. So that's that. We need to move forward. We need normalization. Now, if you're frightened and want to wear your mask for the rest of your life, I'm totally on board with that. If it makes you feel comfortable, plus, that way people can't see you and that may make other people feel comfortable. I'm kidding, not joking. That was just too easy. But I mean, I'm watching people wear masks in their cars. So I noticed that a lot in Chicago when we were there this weekend visiting our son. And when I was back here, I noticed people wearing their masks in their cars. I don't know. I just think it's getting into the wrong habit and isolating people and making people think that we need to be scared all the time. And again, we're going to have, I'm not really making very many gracious points this evening, but anyway, the point is, if you're vaccinated or you've gotten it, you're probably pretty darn immune. And again, there's going to be debates about whether you should get a vaccine if you've already gotten it. I mean, I would go with the Johnson & Johnson, so you only have to do one. There's going to be questions about long-term immunity. There's preliminary data, which you've heard me all talk about, that there probably is. But, you know, for safety, you could get the Johnson & Johnson, which is what I recommend to everybody, because why not get that vaccine? It's going to knock your immune system way motivated to fight COVID, and you'll be in good shape. So that's most of what I have to say. I'd still encourage everyone to take vitamins. People get really mad sometimes that vitamins have been recommended for immune support. Your body needs nutrients to work. So you need alpha interferon, and you want that produced, and you want iodine to give you immune support of your white blood cells, and you want to have a balanced immune system with melatonin. And when we think about kids, they have a lot of things going on that trump the need for nutrition to an extent, because they have human growth hormone. So their immune systems are like stellar. It's great for them. So anyway, so always remember supplements matter. Just like with the blood clotting data, we know that aspirin saved lives, fish oil assuredly saved lives. So all that stuff I've gone over a bunch of times. But again, with the zinc now, if you've been vaccinated or gotten it, you can cut your zinc back to 1 or 2 times a week. That's it. And now if you're having some hair thinning, like I am, 3 or 4 times a week. But that's all you need. So the zinc you can cut way back now. You can cut way back on the melatonin if you've had or have gotten the vaccine. Again, more than 1 milligram, or unless you're taking it for sleep. I'd still want you on a multi. I still want you on vitamin D. I still want you on fish oil. And then vitamin C becomes an option too. So those are my core thoughts. Anything else, Kim?
No.
No. Okay. So that's it. Good night.